morning. This is Tina Drago coming to you from the Beasley Broadcast Studio A. This is Healthy Las Vegas. Good morning, Las Vegas. Today we have in the studio Mark Degen. That's Dr. Mark Degen. We could call him Dr. Doctor because he has a DDS and an MD. How are you today, Mark?
Very good. Thanks for having me.
Wonderful. Now, you're an oral surgeon.
I am.
And tell me, what is an oral surgeon?
So the technical term is oral and maxillofacial surgeon. And the reason is because...
Wait a second. Say that again?
Oral and maxillofacial surgeon.
That's a lot of words.
That's a lot of words. Actually, it was adopted, I think, in the late 70s. They changed the name officially from oral surgeons to oral maxillofacial surgeons. And the reason why they did that was because the original sort of plan for the specialty was to work specifically just around teeth or exodontia extractions. And over decades, and actually centuries' time, it expanded to where now oral maxillofacial surgeons do surgeries not only of the teeth or the jaws, but also of the face and even of the head and neck. So
you are from the shoulders up. You're the guy.
Well, I'm one of the guys.
One of the guys, okay. I like to think you're the guy.
Well, thank you.
So you are an oral surgeon, oral maxillofacial surgeon. They say that right?
You did.
Okay. And it's more than just extraction. So give me an idea of the services that people can expect from an oral surgeon.
So it's pretty wide varied, and sometimes it even varies from practitioner to practitioner depending on their training, depending on their focus in their practices. But in general, oral and maxillofacial surgeons do procedures like taking out wisdom teeth that are impacted, extractions under sedation or anesthesia.
Now, wait a second. Yeah. There used to be, in the olden days when I was a kid, any dentist would take out your teeth. Now it's a specialty?
Well, it's a specialty for really tough extraction. So a lot of times you'll have teeth that are deeply embedded in the jawbone. Sometimes you'll have teeth in odd positions that don't make it a very easy extraction. And even sometimes patients, especially in the Valley, we have here a lot of retirees who have complicated medical conditions that could then complicate extractions as well. So those are all things that I usually see come through my office.
And when people come in for these extractions, do you gas them? Do you give them the laughing gas, or do you give them, like a Valium, or how do you sedate them?
Most of the time, to make patients comfortable and put them to sleep, I usually start an IV and I give them IV medication.
So this is a real surgeon.
Yeah.
Okay, so that's a big difference.
Certainly, yeah.
A lot of people out there do extractions just under sedation.
Right. So there, a lot of dentists might do extractions with anxiolysis, where they're giving you a pill to make you comfortable, like relaxed in a certain way, but not asleep. And sometimes that works for anxious patients with less complicated extractions, and sometimes it doesn't work for anxious patients. Sometimes they need a little bit more. Sometimes the surgery itself is a bit more complicated, can create more pain and anxiety, and that's when usually the patients get referred to me.
Okay.
And we have, my office is accredited by a national accreditation agency.
You're JCO accredited, aren't you?
Well, it's AAAHC, which is kind of a peer to Joint Commission. It's the full term is Accreditation Association for Ambulatory Healthcare, but it is a national accreditation agency. A lot of the surgery centers in town and through the nation are accredited through them. So that means that a third party, unbiased third party, had come into my office and they've reviewed my policies, procedures. They have seen me do my surgeries, seen the infection control procedures, and they meet their high standards that they produce.
So you're not just a dental office, you're a surgical center.
Basically, we're held to that same standard, yes.
That's phenomenal. So people can really trust that they're being taken care of.
Yes, they can.
So besides pulling teeth out, what else do you do?
So I like my focus in my practice to be more geared towards dental implants and restoring form and function to patients who have lost teeth through not only through cavities or just teeth that had fractured or failed root canal, but also if there's any traumatic problems, trauma, losing teeth from trauma or from pathology or anything like that, I usually can help restore patients' form, function, and their self-confidence and their ability to function again.
So tell me, what does it take to have an implant put in your teeth or in your jaw?
So let's say you've already lost the tooth and you have a tooth that needs to be replaced.
And you have a Halloween hole in your mouth?
So if you have a gap that from a cosmetic or from a functional standpoint is really problematic, patients will come in. I'll do an exam. We'll get some radiographs. My office also has a 3D CT scanner, so we can get a three-dimensional view of exactly how much bone is in that area to better plan and proceed with the implant placements. And so once that's done and there's an appropriate amount of bone, basically there's a surgery to place the implant, which is a titanium fixture or screw that's placed into the jawbone itself. And typically it takes about 4 to 6 months for the implant to integrate into your jawbone, which means it becomes actually part of your jawbone to where you can't just unscrew it out or pull it out. Within that time period, depending on the criteria that the implant may or may not have met, sometimes you can put a crown on it, a temporary crown, so that if it's in the front, cosmetic purposes can be basically taken care of at that point. If it's in the back, sometimes we bury it back under the gum tissues for that time period so that it's undisturbed while it's healing. At the 4 to 6 month mark, depending again how fast the patients heal and where exactly the implant is placed, we can then uncover it or have the general dentist or a prosthodontist, somebody who's restoring that implant, work on getting the crown on it. And that's just one example of implant treatment. So if some patients have no teeth in their mouth or wind up losing all their teeth in an arch, in which case then they have other options that implants can come into play. Like for lower dentures are notorious for being extremely difficult to secure onto that lower jaw because there's less surface area as compared to the upper jaw. And
so is that why people make those hissing noises and they flap?
Not so much the hissing noises, but yes, the flapping of the denture sometimes, or if somebody's talking and very rarely they may come out. Or
I had a grandmother that used to do that.
Or sometimes, when you're chewing food, it could be a bit embarrassing for patients and frustrating also, especially if they're coming from having their natural teeth to all of a sudden going to a full denture.
Right.
So in those cases, we can put implants, a lot of times just 2 in the lower jaw to help secure the implant,
so it's like anchors?
Denture. Correct.
Oh.
It'll help. It's sort of like male-female attachments. The male attachments will secure onto those implants. Female attachments will be in the denture, and you just pop it in, and it'll help secure.
Can you take them out then, or are they in permanently?
The dentures you could take in and out. However, the implants stay. So, it's one aspect of being able to help secure removable prosthetics.
So if you have dentures, this would be like the Cadillac way of doing it?
Right. Yes. The other options people have, especially if they have no teeth left in an arch, is what they call an all-on-4. And that's a term that's used usually to indicate teeth for the entire arch that are secured by 4 implants, sometimes more, but usually 4 implants. And they're fixed on those implants to where you don't take them in and out like you would a denture. So those are they feel more like natural teeth. You don't have to remove them, so that they're fixed in the jaw and on the implants to where it will feel to you as more. It'll be more of how you were when you had your own teeth. To where people have their own teeth, they don't take them in and out every day, and this will be the same sort of.
So you just maintain them like you would your regular teeth.
Right. It's not quite. You won't be able to floss between them, but you'll have to floss underneath sort of the prosthetic itself that's secured to the implants, and of course you'll have to still follow up with your dentist for hygienic cleanings. Sometimes 4 times a year, sometimes twice, depending on oral hygiene and depending on what your dentist feels is right. But you still need to maintain them. But it's a great option, especially if you don't want something that's removable. It's really a wonderful option.
So like people who would go get veneers or things like that, if they're really uber conscious of their smile and their teeth, is this like a big thing in Hollywood?
It probably is. I don't know firsthand, but if I was in Hollywood, I'm guessing a lot of those actors that have had to have lost teeth may be going that route, but I don't have any firsthand knowledge of it.
No. That's wonderful. I know my husband's had implants. He loves them. They're his were kind of 1-offers or 2-offers here and there. But his were actually from traumatic injury during his military experience.
Sure.
So all you vets out there, if you're gumming it or missing teeth, give Dr. Degen a call.
We can help.
He's with Red Rock Oral and Maxiofacial. That's Dr. Degen, Red Rock Oral and Maxiofacial. And can you give them their phone number, please?
Yeah, absolutely. It's 702-253-9090. The name of the practice is Red Rock Oral and Maxiofacial Surgery Center. It is my private practice, so I'm really the only oral maxillofacial surgeon there.
Yes, but you have a team of people that surround you.
I do. I have a wonderful team.
That's
wonderful
phenomenal.
Staff that'll make you feel comfortable and really feel special in the office.
So implants are your baby. Extractions are the bread and butter.
Yes.
And is there anything else that you do in your practice or that people can come to you for?
Well, the dental implants have, different components. Some patients don't have enough bone to place implants in. And so part of what I do is to help repair the area in terms of bone grafting. So if there's bone missing, say in back part of your upper jaw and you need grafting in the maxillary sinuses, we do that. If you need augmentation of bone grafting in the lower jaw or the upper jaw, wherever you need it, I do a lot of that, and I enjoy doing it. And again, it helps with the end goal of getting teeth back into your mouth and getting your form and function restored so that you can smile and go out into the world and do what you need to do.
So you do work with a lot of cancer patients, don't you?
I do. Actually, I work with an organization in town called Smiles for Survivors. And I think the website is smilesforsurvivors.org, if I'm not mistaken. But it's it's run by a local dentist here in town who helps to coordinate care for patients in need who have had really, it started with breast cancer survivors, but I think she expanded it to really any cancer survivors who need help getting their mouth back into a healthy state. Why would
cancer survivors have an issue with their mouth?
Well, a lot of times part of the treatment for cancer would be chemotherapy. So the chemotherapeutic agents a lot of times can alter the makeup of your saliva. Sometimes they may actually decrease salivary flow, and so a lot of times saliva is meant to protect your teeth. And for whatever reasons, after undergoing chemotherapy, a lot of patients will wind up having multiple cavities, bone loss, periodontal disease, all that type of stuff. And it's not necessarily through the fault of the patient where their hygiene wasn't up to snuff, but rather through the treatment, this is sort of an end result. And even head and neck patients who have had not just chemotherapy, but radiation therapy, those patients also find that they suffer with many dental ailments that wind up having to get their teeth removed.
Wow. That's kind of one of those stinky side effects that most people don't expect when they've gone through this battle to begin with.
Right. I mean, unfortunately, everything that we do has its advantages and its disadvantages, its pros and cons. It's like that in life with anything. Obviously, if somebody has cancer, the end goal is to have them survive it. And along the way, there are other things that occur and complications and, sequelae, and we're here to help take care of that.
What about nausea?
That can happen with chemotherapy, especially. Yeah. So
and pregnancy.
And pregnancy as well. Yes.
That was my biggie. I had 10 months of morning sickness. Yeah, I know you're only pregnant 9, but I had it for 10.
Wow.
Yeah, It was no fun.
Well, my hat's off to you. I don't think I'd be able to tolerate that.
No, you wouldn't have any children if you're the first one. That's it.
I'd be thinking long and hard.
Now our viewers don't know that Dr. Degen has twin daughters, so it was only a one-time experience. And he didn't have to carry them.
That's right.
So that's a good thing.
I lucked out.
So tell me about, are there any other ailments that you work with besides the cancer?
Well, if patients have any problems really that affect their mouth, my office is always open to them to at least explore what might be happening, try to get a diagnosis and provide treatment for it. So if there's any pathology there, I will assess it, and if a biopsy needs to be done and follow up on it, that's what we do. If you need additional imaging, like I said, we can do the CT scan in the office, the three-dimensional scans. A lot of times people had to go to an imaging center to do that. I could do that now in my office with lower dose radiation than the CT scanners out in those diagnostic places. If somebody needs an MRI or any other imaging for diagnostic purposes, we can send them to get that done to help come to a diagnosis and a treatment for the patient.
Now, you guys have to know, Dr. Degen got his training.
Yeah, so my training, so I went to, my undergraduate degree was at New York University. My dental degree was also, I got from New York University in New York. And then I did go to medical school as well, and that was done at LSU School of Medicine in New Orleans. And my surgical residency included a year of general surgery and finished up with oral and maxillofacial surgery. That was also done at LSU Health Sciences Center in New Orleans.
Now, when you go into his office at Red Rock Oral and Maxiofacial, you'll get a little of the Big Easy feel down there, and that's fun. It is.
Yeah, the motif in the waiting room is all New Orleans, so it's meant to convey hopefully a relaxing environment where good times will be had.
There you go. So tell me about your time in New Orleans. You studied. You worked in the VA hospital, didn't you?
I did. That was one of the hospitals that we rotated through. Yes.
And then you came to Las Vegas, and you actually taught at the UNLV Dental School as well, didn't you? I
did for a short period of time. I was on faculty there teaching in the emergency clinic, and it was very fulfilling. And I hope one day to return to it because I really do love teaching and, trying to help mold the next generation of healthcare practitioners that'll help us and especially, me when I get older and everybody else all around me to help us kind of manage getting a little bit older and taking care of problems.
So everybody out there in Las Vegas land, my family has had experience with Dr. Degen because all my boys had their wisdom teeth taken out, and Dr. Degen took care of them. And to say it was a pleasant experience, it was the most pleasant experience you could possibly have, having all 4 of your wisdom teeth removed at once. My oldest son, he just raves about you because he was able to go to his brother's ceremony for sports events and everything the day of the event.
Oh, that's funny.
The younger one, he raves about you because he didn't look like a chipmunk, and just 2-3 days later, he was back in the swing of things at his fraternity. So all was good in that area.
I'm glad to hear that they had a good experience.
They both did. It was pretty funny. The younger one was worried about hitting on the girls after he came to, because you actually come up from your anesthesia.
Uh-huh.
So when you go in there, he puts you down and you come back up, and you both my boys thought they were Lance Romance. So it was kind of funny. So understand, everybody out there, that Dr. Degen works with dentists. So if you have a dentist that you love and you want to, you never want to leave that dentist, that's phenomenal. Dr. Degen's kind of a hit and run. I don't know if you call it that.
Well, I help other
He's
dentists
the
or other practitioners to help get their patients what they need, what's appropriate for them from a surgical perspective. If your dentist can take care of you in every aspect, that's great, but I'm here to help. So,
and it's another level of care. So primary care doctors, will know that we see it every day at First Person. So you come in and you have hypertension, but your EKG shows that your cardio, your heart maybe isn't doing what it should do. At that time, a good primary care doctor will refer you to a cardiologist. Well, a good dentist, when it comes time to doing any kind of surgery, extractions, sedation, should refer you to a good oral surgeon. And that's where you want to do that handoff. So never feel like you have to leave your primary dentist or your primary doctor to work with a specialist. Just know that those specialists are out there and that they're going to give you that higher level of care that every patient should deserve.
Yeah, thank you. And we work with a lot of good dentists in town here. And, if there are any others that wish to speak with me, I'd be happy to talk with them, and I'd be happy to see their patients.
So if they want to talk to you, what number do they call?
702-253-9090.
Now, is there anything else you do in your practice? Because you're taking care of the entire face.
Oh, so yeah. So I do offer, part of our training at LSU also encompassed facial cosmetics. And I don't do any facial cosmetic surgeries, but I do facial enhancements, cosmetic enhancements like Botox and dermal fillers like Juvederm or Restylane, and patients love it and they have a great experience. I also do Botox for primary underarm sweating. So if you have a real issue with that, come over and we'll take a look and see what we can do for you.
And I have to tell you that is, it's a wonderful environment to be in. And when you go in, and the whole Botox experience and the Juvederm experience is also, it's a very positive, because you're getting the wonderful surgical suite that you don't necessarily always have in a cosmetics office. And you're getting somebody who is a surgeon in face, in maxiofacial. And if you look at cosmetic doctors out there, a lot of them are internal medicine that have studied extra for that, and they're not necessarily a surgeon, and they're not necessarily a maxiofacial surgeon. So take your time, look around, and think a little outside the box, because these oral surgeons or oral maxiofacial surgeons are actually, that's what they're trained in specifically, the neck on up.
Yeah, we had at LSU, we took facial trauma call every third night. So we were doing an enormous amount of full facial trauma repair and reconstruction. And
would that be like cleft palates, or?
Well, that's part of what oral maxillofacial surgeons do, but I'm talking about somebody who's been in a car accident or who's had a horrible accident that fractured any of the bones of the face or lacerated any tissues of the face, including the scalp and the areas around the eye, the nose, the ears. All those type of injuries we treated on a very regular basis. So facial trauma was pretty ingrained in my training. And once you learn the surgical accesses to the facial skeleton, you kind of get to intimately know every part of the face, how it should look, because obviously you want to make sure patients wind up looking as much like themselves before the accident than during. So that helps a whole lot in terms of being able to do facial cosmetics.
So would you be up for talking to people who have had facial trauma?
Yeah, absolutely.
So that's another area that you're looking into. I mean, nobody wants to have facial trauma. Nobody wants to experience these accidents, but it sure is nice to know that there's somebody out there with formal training that can actually give you that guidance and help. Right, absolutely. Now, if you are involved in a traumatic accident, obviously you want to go to the emergency room and make sure you get evaluated there so that there aren't any other concomitant life-threatening injuries before you decide to work more on the cosmetic side of things. But you want to make sure that there's no there's no hemorrhaging in the brain or orbital issues like eye trauma or anything like that. So definitely go to the emergency room, God forbid that happens to you, and make sure everything else gets checked out is okay. I'm just thinking of a mother of two boys. Soccer, hit in the face. Baseball, bat, hit in the face. Football.
Yeah.
My son golfs. You don't know how hard it hurts to get hit with a golf ball or the club. So when those things happen, and God forbid they happen to your face, you can think outside the box a little and look at oral maxillofacial surgeons. How many of you guys are in town? How many dual surgeon or dual degreed MD and DDS in Las Vegas are there? There's not many. So
there are a handful. There's maybe about, maybe around 5, could be a little more, could be a little less. There are single degree oral surgeons also in town. There's many more of them. And they do a fair amount of good work as well. But
so a single degree would be just an MD?
Just the DDS.
Or just the DDS.
Yeah.
Okay, so there's people that are doing oral surgery that are dentists.
Right.
And they've taken a class?
Well, no. Oral maxillofacial surgery is a dental specialty by definition. So you don't need the MD to practice it. The reason why I got the MD was because I wanted to learn a little bit more, and I also had the opportunity to get into a program that provided me with that. So I don't know about you guys, but I think more education's good when they're whittling away on you. Sure. Well, it's. You never know when that little bit of extra education would come in handy, and I wanted to be able to take care of my patients as best I can.
I really appreciate you coming in today, Dr. Degen. That's Dr. Mark Degen with Red Rock Oral and Maxiofacial Surgery. And his number is
702-253-9090. Thanks for having me.
You're welcome. This is Tina Drago with Healthy Las Vegas coming to you from Studio A at Beasley Broadcast. Just remember, everybody, First Person Care Clinics, your primary care provider for pediatric to geriatric here in Las Vegas. Have a wonderful day.